Hi, everyone. No pressure following Lord Nigel Crisp. I'm going to use my time to talk a little bit about what we've learned from our own experiments at MIT. And I also want to offer you some ideas that might be helpful in trying to dig into what some of the words we've been bandying about might mean. So my particular focus will be on systems thinking. And then soon you're going to hear from Uta, who's going to tell us a bit about her line of work on behavioral methods. So I think it'll be really interesting to try to contrast the two. This is me in Dhaka, in Bangladesh, with Shahid El-Haq, Ola Alani, and Andrew Tran, my students. We are truly a global university at MIT. And we have been working with BRAC for several years. BRAC, you might know, is the world's largest nonprofit that's pretty mostly self-funding, with about 50 for-profit businesses that generate revenue that in turn allow it to deliver healthcare to around 30 million people. And the vehicle for BRAC is a health worker called a Shastry Shebika, who goes to villages and delivers doorstep healthcare. Our task in this project was to figure out what else could the Shastry Shebika be doing. So I was listening very eagerly to the previous talk, thinking this is a challenge around the world to figure out how to leverage and make the most of and empower frontline health workers who are really able to understand the community, the issues, the needs of the people they're serving. And it was a great experience. I'll tell you later on about some of my others in this domain. But first, a bit of systems thinking. So, systems thinking has a long history, but when you look at global health, it really came onto the scene a decade or two ago. By the 2007, the WHO issued this report, really arguing that from here on out, when we're thinking about making big changes in global health, we should always do so with a systems lens. And in fact, Rifat Atun, who was at Imperial, now at Harvard, was one of the main authors of this piece. And it very much drew on the discipline that I myself have studied over the years. But systems thinking is actually a very old idea. I mean, here in the UK, Maxwell took the idea of control theory and used it to build the mechanisms that controlled steam engines and then industrial machines, creating the whole dawn of the industrial age. So systems thinking is actually linked to engineers' concept of control theory. But doctors, biologists know homeostasis. They have other kind of metaphors, models, and approaches that look at systems that also embrace the feedback thinking approach. Interestingly, feedback thinking fell out of vogue for a while, in part because you guys know from using an Excel spreadsheet, you can't have circular references. It was an artifact of our ability to compute that often made us pretend that systems weren't connected and instead to treat the parts as separable and isolatable. But now, thank goodness, we have simulation. So we don't have to actually analytically solve complex systems. If we've got good math and good data, we can simulate. And boy, have we been simulating. Here's a recent example that'll make you cry. This is actually a very infamous system dynamics diagram developed in the early 2000s. It's actually for the US government's military approach to counterinsurgency in Afghanistan. Someone leaked this diagram, and it went on like the front page of the newspapers, and people said, are we crazy? How can anyone understand this? The truth is, used well, even a complex model can actually really help you think through trade-offs, tensions, questions. What we often look for are shifts in behavior mode rather than making point predictions or line predictions. We're saying, what does it take for this effect to dominate over that effect, for instance? How do we get a tipping point to work in our favor instead of against us? So one can use simulation in that method. I would not use this to communicate to people. To teach you like 2 minutes on the language of system dynamics, which is my particular lens of systems thinking, I pulled out some diagrams from a pretty interesting US National Cancer Institute study on smoking cessation and tobacco use. So the US has invested a lot, as has UK governments and others, in figuring out how do we prevent people from taking up smoking or help them to quit if they are. And for many years, it followed a very conventional approach. But here we are at Report 18. So they've already put a lot of effort into the other approaches, but Report 18 says we need to look at the system. And they actually do a quite nice job. So I just pulled out a few diagrams. So I'll use this to just explain how we think about systems. So the box there means there's what you might call a state variable, and something you count that's a stock or a state. The number of smokers, you can read this the following way. If the number of smokers go up, revenue made by the tobacco industry goes up. As tobacco industry revenues go up, there's more incentive for tobacco growers to enter the market. The more tobacco that's on the market, the more available cigarettes and tobacco products are, the more people who start smoking, the more smokers you have. This is a non-virtuous positive feedback loop. So the more people who smoke, the more attractive the market is, the more the products are produced. You have to then start adding lots of other things to actually get to a more nuanced understanding. For instance, is there competition? Because that would work the other way. It could drive down the price and reduce the attractiveness of the market for new entrants and so on. I just want to show you the diagram. And of course, you can then add new things. The nice thing about systems thinking is a single factor can have multiple causes, multiple effects. So you can begin to add a little bit of complexity and ask the question about which effect dominates and which one, how do they combine? Do they work together or against each other? So here we have a social norm being mapped out. Smoking becomes more acceptable. And then you can add other bits. Won't go over this, but I wanted to use this so we tend to build these models step by step to really help us unpack, explore, and understand how a given phenomenon plays out, both retrospectively and then to talk about what could the possible futures look like. Okay, so now I've equipped you with a little bit of language. Now, what does this have to do with entrepreneurs? Because this is usually pretty high-level policy stuff when you find these really well-described systems models. But we have, certainly at MIT, built a massive body of research, also using this method to model individual firms, to look at their trajectories, to look at their problems. Funnily enough, most of the use has been studying established firms because they're big enough, they have enough data. We've really done very little in looking at startups and looking at entrepreneurs. So it struck me today that there's two potential values of systems thinking. We can use it to help provide some context so that if you're providing a new service or a product, you can start to think through some of those knock-on effects, just like you saw in the tobacco use diagrams, and say, which part of the system am I going to be shifting? And will it have the eventual effect I'm hoping? What else might come into play? You might use such a model heuristically. You might not need to simulate it. You could use it simply to talk through, explore, question yourself, and get others to weigh in. So models in that sense are excellent transitional objects that allow you to interact with other people around your ideas. You could also use this method to take a look at your own business model and ask, do I have the ingredients for scale, sustainability, and quality? And we find that businesses that actually survive and do well, as well as nonprofits for that matter, are ones that figure out how to get better and better at something and reap the benefit of experience while staving off some of the limitations that might come. Sometimes they stave off competitors. Sometimes they offer such a good offering that others can't compete easily, for instance. So I thought I would take I'll actually take an example from this morning and talk you through how we might use it, so you get a sense of how we can use systems thinking. But first, how have we actually managed to tap into our own experience in doing this? So this is like a mini segue. How have I and how have us learned about global health? I am not trained as a clinician or a medic. How on earth did I get a position at Harvard Medical School? Because I just jumped in. We've worked with dozens and, I actually don't know what the number is, hundreds of MIT students through the Legatum Center, not only our own entrepreneurs, but others. This is a snapshot from 2 years ago, so the numbers are even bigger. But we have our own students to talk to follow, to learn from. That's why we keep talking to Javier, Caitlin, and others. We're learning from their journey. I've also been able to create an effort called Global Health Lab at MIT, and we have, believe it or not, we've done 95 projects directly on the front lines of care delivery using the students as my kind of workforce. But this has also enabled me to really see how things play out in situ. So sometimes we're often working with public or private faith-based clinics, but we also work with startups, with companies, with firms that are looking to expand into low-resource settings. So this has taught us a lot. So one of my pieces of advice for faculty here, you're already doing so much when you're teaching and research, but is there any way to pair the two? Use your teaching as a way to glean some research in the field and equip your students to go out there and actually implement real changes. Great. So I won't belabor these details, but I put them up there just to give you a sense. I know most of you may not be able to read it. The other thing we also did was going from a problem-driven set of projects with our students was also to say, who is cracking the code on delivering a social good with scale, sustainability, and quality? So my students we've done prospective case studies of many, many startups saying, do we think they will go on to make a difference in the setting? So I have now been doing these sort of forward-looking, using systems thinking, forward-looking models of businesses that we are observing that are setting out to do social good. Most of them are health, but not all. And then we can look at them down the line and ask, how did that play out? So that's really helping my students to try to unpack, how do these pieces fit together? Do they have what it takes to get better and better? Do they have what it takes to be the preferred product or service over others? So that's been a fascinating thread of work for us. Finally, I made the argument that systems thinking can be really useful in thinking through a business model so that you can deliver on the ideals of this conference. So you can find a solution that works for real people that they would choose to use, and that finds a path to financial sustainability, social sustainability that works within the setting. So let's take a look. I think we should look at Javier. So I'm going to take Clínicas del Azúcar as my example. And this is just 3 little loops. I'll just talk you through them, and we'll see if we think it's useful. So a basic feedback loop that governs most firms is the volume of production, in this case, the volume of patients you serve, allows you to, as you serve more and more patients, you can drive down the cost per patient. This already actually raises some interesting questions. In healthcare, very often your fixed costs are lumpy, right? There's a clinic, you run it to max capacity, then you have to build another clinic. So the relationship between volume and cost is very nonlinear. You have to actually really understand how that lumpiness plays out. And for Javier, trying to manage his cost per patient, he's been very thoughtful about the investment in fixed assets that enables him to squeeze out the maximum value and not grow too fast with having low utilization in some of his sites. That's a huge potential trap for him that he's very carefully skirting. As your cost goes down, of course, your break-even price can fall and you can charge less. This is an interesting link. I've drawn a positive relationship here, right? Meaning as your price goes down, as your break-even price goes down, the price you charge can go down. But this is a decision. You could choose to charge more, right? So this morning we actually heard about value-based pricing, which is not this kind of pricing. Value-based pricing says, what's it worth to you, health system? We'll charge you that. So often healthcare entrepreneurs have to wrestle with that question. Do I charge the max the market will bear? Do I charge the min I can get away with? And you have to figure out why. In Javier's case, there's a real reason to build volume because that's his kind of learning loop, as we'll see in a moment. Just to close this loop, the lower your price, ceteris paribus, all else being equal, the attractiveness of your offering will be better. The more attractive your offering, whether it's a product or service, the greater the demand, the more you can sell, the lower your costs can go. So this is this virtuous cycle of economies of scale that no doubt is familiar to all of you. this one says, look, the same thing, the volume of patients served, can also drive a learning loop. So the more patients you serve, the more data and evidence you can glean, then the more scope there is for you to get better at what you're doing, and the better the quality of your offering, because you can solve problems or innovate. This all makes sense as a kind of prescriptive framework, but it skips over, it doesn't reveal the challenge and complexity of actually doing it. I used to be a management consultant. We would often see firms that were failing to reap the lessons of experience. Because to do that, you actually have to invest in learning. So there's another cost here that I didn't represent. But this is actually what the NHS has been working on for so many years as well. How do we harness our own experience in the field? Whether it's a surgery that goes well or one that goes awry. How do we scrape out what we've learned from this and embed it into practice? And I'm fascinated by organizations that figure out how to do this. In Javier's case, that partnership he mentioned with Deloitte is allowing them to really use many different approaches to analytics to pull out patterns in the data of customer usage. He is trying to craft an offering that will reduce loss to follow-up so that patients come back, not only within that moment in time, but they also, within that phase, but also that they re-up their subscriptions so they stay on the treatment over the long haul. So he has a lot of scope for learning and improvement using data. Finally, there's a really interesting loop I thought I'd throw in here since I know there's many doctors in the room. We've looked at clinics and hospitals that have found other ways to reap the benefits of scale and volume. So in this case, the greater your volume of patients served, for some docs, especially surgeons, you know who you are, the more patients you get to see, the more interesting the cases are, right? So you see more patients, you get those more, edge cases or weird cases or interesting cases. And that can actually be an attractor for staff. So I've worked closely with and studied Aravind Eye Hospital. They leverage this loop like no one else. They actually pay very low salaries. They attract the world's best eye surgeons. Why? Go to Aravind and you'll have like more than 10x the experience than you get anywhere else. And in this case, surgery is a huge return, there's a huge return to practice, to your skill level. So the more you do it, the better you get. This is a huge draw for surgeons. So I keep wondering, are there more opportunities like this? To actually make a virtue out of being busy, to attract people who are willing to work really hard. We need new business models, new thinking on this front too. So I'm hoping you're seeing that this method allows you to have a conversation, lay out some thinking, test your own mental or formal models, and get other people around you to weigh in with their thoughts, their feedback, their ideas. Again, use the model not so much as a prediction, but as a tool for having a discussion. So that's my argument. Systems thinking, I think, based on all the work we've been doing over the years, gives us a great tool for bringing a new level of rigor to the conversation, thinking, and planning that even early stage entrepreneurs engage in. And this is all the more important in global health. Why? Because we mostly tell entrepreneurs, do some minimum work and then go out there and test it in the market. The cost of market failure for healthcare in a low resource setting can be unacceptable. You may be withdrawing clinical services from patients who need it. You may be destroying public trust, right to operate, or even the notion of your idea. So we cannot afford the same gung-ho, go let the market tell you approach when we're looking at global health, especially when we're serving the underserved. We have to think really carefully about the experience we can draw on, the modeling we can do, the conversations we can have. You, the experts in the room, should be talking to all kinds of entrepreneurs, pushing back with them, but not telling them too much because they need to also come up with great ideas. But I really feel like it's important for us to find that frontier that allows innovation without destroying any public good. So that's definitely the mission. All right, thank you very much.